Hello, my name is Hugo and this is my head-to-toe video assessment. How are you today?
Good.
I'm David.
Hi.
Okay, first we're going to start off with the inspection of the skin. The skin seems to be of light tan pigmentation. Can you come a little forward? Straight. Let me see your arms. There are some primary lesions in the form of macula in the anterior aspect of the upper extremities, the forearm, a little bit there. If we look at the legs, it's also light tan pigmentation, some primary lesions in the form of macula in the dorsal aspect of the foot, the right foot, left foot also. Bit of all scarring there, all scarring there. If we look at the skin, it feels warm to touch. Warm to touch. Also, the legs, do you shave?
Yes.
No sign of folliculitis. Let's see if we know varicosis. No edema is present. No edema. Okay. If we look at the nails, inspection of the nails, they're trimmed and short, and the nail bed is adherent to the nail bed. Let's see. We press here. We're checking for capillary refills. We would do that to this arm too. And the toes. The toes seem cooler than the rest of the body. That's within normal limits. Capillary refill is less than 3 seconds. That's evident to good oxygenation, and we're checking for tenting. No tenting is present here. Tenting here. No tenting across. Okay. That's evident of good hydration. Okay. Now we're also going to move on to the head. The head is symmetrical. Okay, and we look at the scalp. There's no lesions, no signs of alopecia. If we look at the hairs, it's well trimmed. No signs of alopecia, as I mentioned. Feels coarse. Okay, good. All right. And then we also look at the scalp. There was no clicking and any pain there. No crepitus. Okay. The peroneal sinuses, no tenderness there.
No.
Okay. This is the transmandibular joint. If you don't mind just opening and twitching side to side. Okay, good. And push here. Push outward. There we go. Okay, good. Alright, so no tenderness there. We're also going to look for, we're going to test for cranial nerve number 5, trigeminal. And you could, if you don't mind, just scope in here. This is the stuff that I will use. This is, okay, back to here, honey. Back to here. This is soft, and this is hard, okay? You keep your eyes closed. You're going to tell me?
Soft. Soft. Hard. Hard. Soft.
Okay, that's testing cranial nerve number 5, trigeminal. We would also do some facial gymnastics, which is cranial nerve number 7, facial movements. So we're just going to ask you to smile, show me your teeth, frown, purse your lips, puff your cheeks, stick your tongue out, and very good. And this will also keep your eyes closed. You're going to try to open your eyes. Okay, that also tested for trigeminal cranial nerve number 5. Okay, now we're moving along to the eyes. Look at me. Okay, and we're going to inspect the eyebrows. The eyebrows are symmetrical, well trimmed. Okay, the eyelashes are curled upwards and outwards. Okay, it's symmetrical. If we look at the conjunctiva, it's pink. We look at the sclera as white with some vessels there, and the pupils are equal and round. Okay, and no signs of ptosis. And we're also going to run a test with my pen light. If you could just look at the wall over there. Okay. Okay. And you could just keep looking at the wall, and as soon as you see my pen, focus on this. Keep looking at it. Okay. So pupils are equal and round, and reacting to light and accommodation, both bilateral and consensual. And we would also run some other tests for the eyes. This is testing cranial nerve number 2, optic. We did the Snelling test, which tested for distant vision. She stood 20 feet from a board with letters. They got smaller as you go, and that tested for distant vision, and also for near vision. We did the Rosenbaum test. She held a card 14 inches away. She did well. Do you wear glasses?
No.
She did that without her glasses, and because she doesn't wear any, and then cover one eye at a time, and then without covering her eyes. We're also going to test for peripheral vision. Okay, so if you cover one eye, okay, cover that eye, and then you're going to tell me when you see this pen.
Yes. Yes. Yes.
Okay, keep that eye covered. We're going to do here.
Yes.
Okay.
Yes. Yes.
Okay, just keep looking at me. Okay, no sign of nystagmus. That all those three tests were cranial nerve number 2. Okay, and we're also going to look at the eyes through an ophthalmoscope to check for the retinal, to check for a red reflex from here. We're going to pretend this pet line is an ophthalmoscope and get closer. Okay, so we're checking for lens clarity, and the red reflex is present. We're also going to check for the optic disc, which is a yellow color, creamy color. In the fundus, we see it, and there's some arteries and vessels are present there. Let's see. Good. All right. Okay, now we're also going to run some other tests for the eyes. This is going to check cranial nerve number 3, 4, and 6, which is the oculomotor, trochlear, and abducens. Okay, if you look at straight here, you look at this pen, just follow it. Very good. Okay, now we're going to look at from this way to the pen. Okay, that's the 6 cardinals of gaze, and we would also check for corneal reflex, and we see the light, the reflection of the light is symmetrical on both eyes, and if that wasn't the case, we would do a cover to uncover. So if you could cover one of your eyes, cover it, and then just look it straight, but not turn to the right, and just keep your eyes there and not uncover it. Now both eyes were kept there. Okay, so that was testing cranial nerve 3, 4, and 6. So now we're moving on to the ears. Let's look at the ears. The ears, if you could turn, the auricle, no lesions are present, any tenderness, nothing. The helix recoils back, and it's in proportional to the outer canthus of the eyes. Okay, so now we will pretend this is an otoscope, and we will lift the pinna and look inside the ear. So what we're looking for there, it's we're looking through the auditory external canal. There's some hair there, some mouse cerumen, which is normal, and we're looking for the tympanic membrane, and there were no lesions, no hemorrhages, and we're also looking for the cone of light, which on the right ear is at 5 degrees, and on the left ear will be 7 degrees. We're also looking for the umbo, the malleus, the pars tensa below, and the pars flaccida is above. Okay, so that was the ears. So no discharge are present there. So now we're moving on to the nose. The nose symmetrical. If you lift up, the nares are both symmetrical and the same size, and we're looking at the inferior turbinates. We can see it. There's the septum. Let's see, is moist. Okay. Now we're gonna test if you could close one nare, and breathe in, and then do it with the other one. Okay. Now we're gonna test for the nasal. Do the same and close your eyes. The same. What do you smell?
Lemon.
Lemon. And that include the other nare, and you're gonna tell me what. Keep your eyes closed.
Peppermint.
Okay, peppermint. That was testing for olfactory cranial nerve number 1, smell. Going back to the ears, which is this is gonna test cranial nerve number 8, acoustic. With this tuning fork, I'm gonna put it above your head, and you're gonna tell me if you could hear or right on the left. You could hear both.
Both.
Okay, good. All right, very good. So that was the Weber test. Now we're gonna test for the Rhine test. Now I'm gonna put it on your mastoid process over here. Can you hear it?
Yes.
Does it stop?
Yes.
Can you still hear?
Yes.
Tell me when it stops.
Stops.
Okay, very good. Okay, so air conduction is greater than bone conduction ratio of 2 to 1. I just want to do the whisper test also. If you could cover one ear, and I'm going to say something and repeat it.
The weather is hot.
Okay, very good. Very good. Okay, and we would do that bilaterally. That was testing cranial nerve number 8, acoustic. Okay, now we're moving along to the mouth. The mouth is symmetrical. The lips are pink. They're non-chapped. If we look at the gums, if you don't mind opening your mouth, look at the gums. It's pink. The teeth are white. If we inspect inside, if you lift up your tongue, we look at the frenulum's present here. We look at the Wharton's duct present here, and the Stenson's duct both here and here. And inside the mouth is pink. There's no ulceration. And if you stick your tongue out and go ah, we look at the uvula is midline and proportional to the rest of the mouth, and the tonsils is +2. We lift here. This is rugate. That's the palate, the hard palate, and then you follow upwards to the soft palate. Sorry, and the tongue you can see is well papillated and it's avascular, and the borderlines are smooth. Now, if you could, all right. So now we would ask you to swallow. Let's see. All right. So now we're looking at cranial nerve number 9, glossopharyngeal, and cranial nerve number 10, vagus, and cranial nerve number 12 is hypoglossal. If you could stick your tongue out and move it, that's tongue movement, cranial nerve number 12. Let's see, very good. And we also mentioned the hypoglossal and the vagus. Perfect. Okay, that's good. All right, that was the mouth. Okay. So now we're moving along to the neck. We feel some paravertebral muscles here palpating. If we look at the neck, is symmetrical. Can you swallow? Swallow. Okay. Trachea is also symmetrical, and we're also looking at let's see. We also want to. Here's the post-auricular node, and anterior auricular node, posterior auricular node, occipital node, submandibular, sublingual, and submental nodes. This is all lymph nodes. Let's see, here's anterior cervical nodes, deep cervical nodes, posterior cervical nodes. Okay, they're non-palpable. If it would be abnormal if I could feel them or swallow them. No tenderness there, right?
No.
Okay. Now we're also looking at the there's no JVD, no jugular vein distension, and we're palpating the parotid this way. Very good. And we're also gonna auscultate with the parotid. We're gonna use the bell, but I don't have a bell. Checking for any bruits. No bruits are present. And if you don't mind just sitting here and facing that way. Sit here and face the other wall. We're going to palpate the thyroids. Just sit straight. Okay. Come close, honey. Come close. Alright. Turn your head to the left. We're going to palpate the right. Come this way so you can see what I'm doing. Come this way, honey.
On the other side.
Okay, we're going to palpate the thyroid here. Can you turn your neck? Can you swallow? Okay, that's fine. Palpate, and then you're going to turn your neck the other way. Okay, good. Very good. Okay. Okay. We're gonna auscultate for the thyroid using the bell. So no bruits are present. Okay. We also have to test for cranial nerve number 11. If you could turn back around, if you don't mind. Okay. Cranial nerve number 11 is the spinal accessories. So bring your shoulders up. I'm pushing against. Okay. And also push against sideways and push here. So that's the sternocleidomastoid muscles. Good. Within normal limits. Okay, so that ends with the neck. Now we're going to move on to the lung portion of the assessment. Okay, we're going to inspect the lungs. You can see respirations. Let's see, if you don't mind taking your shirt off, please. We did the head, the eyes. Okay. So we're looking at the inspection of the anterior thorax and the posterior thorax, some primary lesions in the form of macules here too. We're going to palpate for any, does this hurt? Any bulges? Any masses? No?
No.
No pain?
No.
Nothing? Okay. Alright, let's see. If you don't mind turning back around, I'm sorry. Okay. So now we're going to look for on the 10th rib here for what's it called? Respirations are symmetrical, 10th rib here, and we're also going to do say 99.
99.
That was testing tactile fremitus. Vibrations were felt on the dorsal aspect of my hands. And we're also going to test for diaphragmatic excursion, which is the traveling of the lungs. Let's see. If you could look over here.
Go on the other side.
Yeah, it's fine. We're going to percuss. So take a deep breath and hold it in. Hold it in. Oh, breathe normal. Bring your arms forward and lean forward like that. There we go. Now take a deep breath and hold it. Lean forward a bit. Take a deep breath and hold it. Okay, you can breathe normal now. Okay. Now you're gonna take a deep, just exhale and hold the exhale. Okay, that's percussing for diaphragmatic excursion. See, that's about 4 centimeters, which 3 to 5 centimeters is within normal range. Now we're going to percuss the posterior lung. Okay, you can stand on. Okay. Now we're gonna auscultate the lungs. Just breathe normal. Breathe normal. Breathe normal. Okay. Okay. If you don't mind just turning around, please. Bring your arms up over your head. So far, the lungs sound clear bilaterally with no adventitious sounds. Good. You could bring your arms down now. We're still listening to the anterior lungs. Good. So also anteriorly, the lungs sound clear bilaterally. Okay. Before we continue, I just want you to scan the room. I want you to scan here, this whole area here, up and down, the walls, the floor, over there, all those walls around. Very good. You can scan this floor here too. Thank you. Alright, if you don't mind just laying down. Come closer. Now we're moving on to the cardiovascular part of the exam. We're going to inspect first. We see pulsations. Okay, very good. We're also going to palpate. This is the base of the heart, the lateral aspect of the heart, and the apex. At the apex, this is the left sternal border, left fifth intercostal space, which is also the point of it's the PMI. Okay, and we don't feel any murmurs, nothing. Okay, you don't feel pain anywhere, right?
No.
Okay. Now we're gonna auscultate the different parts of the heart. Okay, we're gonna start off over here on the right sternal border, on the right second intercostal space. Right here is the atrial. Okay, and now we're going to move to the left sternal border, second intercostal space. That is the pulmonic. Okay, very good. And now we're going to move down to the left sternal border, third intercostal space, which is Erb's point. Very good. And the left sternal border, fourth intercostal space, which is tricuspid. Very good. And back to the fifth intercostal space, left sternal border. That is the apex of the heart. Is the apical. Very good. And we didn't hear. We heard S1, S2 normal. We heard no murmurs, no S3, and no S4 were heard. Okay. So now we're also going to check the pulses. This is the temporal pulse. Okay. Here is the carotid artery, and this is the brachial pulse, radial. You're getting all that, right?
Mm-hmm.
Femoral, popliteal behind the knee, tibialis, and pedis dorsalis. Okay, very good. That was that. Okay. So now we're gonna move along into the abdomen. The abdomen is flat. The color of the skin is consistent to the rest of the body. The umbilicus is inverted. Some primary lesions in the form of macula are scattered. Let's see, good, very good. First, we're gonna auscultate before we percuss or palpate. But we're gonna auscultate all the quadrants. Very good. And vowel sounds are present on all four quadrants. We're also going to auscultate, the liver and the spleen. You feel any pain, any tenderness? No? Okay, so that's that. Let's also we usually use the bell. I don't have a bell on my stethoscope. We're going to also auscultate for the abdominal aortic on the left side of the midline, and also the renal arteries. Okay. Let's see. These are the iliac arteries and the femoral. So no bruits were heard. Very good. So now we're gonna percuss the 4 different areas of the abdomen. Let's see. Okay, so tympani was heard, which is normal throughout the 4 quadrants. Over the bladder, it was dull. Okay, we're also gonna percuss and measure the liver. So let's see. So from here, okay, so from here we hear some tympany to dullness. Let's see. Okay, from here to here we hear resonance to dullness. Measuring. It's about 7.5, almost 8 centimeters, which is normal. It's normal to be 6 to 12. Okay. Let's see. We percuss the spleen, and the spleen is non-palpable. If it was palpable, it would be abnormal. Let's see what else we do. We palpate. We're gonna palpate the kidneys. Okay, feel the kidneys, the other side. Okay, very good. Okay. No pain felt throughout that, right? Okay. All right. Very good. Now, since you're laying down, if you don't mind stepping back, we're gonna start off with the musculoskeletal part of the exam, which is we start with the hips. Okay. Let's see. You okay? How do you feel? Okay. All right. So now we're gonna start off with your leg. Bring it up. That is flexion of the hip, and normal is extension. Push upwards against my resistance, and I go up, and I push downward against my resistance. Okay. And we will do hyperextension of the hip when she gets up. We're testing for range of motion and strength of the different joints. Okay, so now, let's see. Bring the leg towards me. Bring your leg towards me. No, bring the leg towards me. That will be abduction, and if you cross your legs, it's adduction. Okay, and bring it back. And now, if you could bring your leg up, like sit like a man, that's external rotation of the hip. Okay, now you're gonna bring your knees forward like that. That's internal rotation of the hip. Okay. Now let's see. Push. Now we're gonna do so let's do this. Flexion. I forget. Oh man. I forget. Push towards me. Okay, and now push upwards. Okay, that was good. Now we're gonna bring this leg towards that. That's inversion of the leg, of the foot, and now bring it outwards. That's eversion of the foot. We're also going to test knee. Okay, that's flexion and extension. Extend it back. Okay, now keep it like that. Try to extend it. Okay, now try to flex it against my flex it. Okay, good. Very good. All right, now we're also going to do the ankles. Try to rotate your ankle. Okay. All right. So now we're gonna plantar flexion was downwards, and dorsiflexions upwards. We did that against resistance, and we will do it also bilaterally. Okay. Very good. If you don't mind, just standing up. Can you stand a bit? Okay. Stand a bit towards me a little bit. Bring this leg back. That's hyperextension of the hip. We would also do that bilaterally. Okay, if you don't mind just standing here. We're going to do a few exercises, okay?
Okay.
Okay. Alright. This is, first we're going to start off with the neck, okay? Go like this, flexion, okay? Extension, hyperextension. Rotation, okay? Lateral movement. Now you're going to go against my resistance, push. Now back, like that. Okay, now move it like this. Okay, that's lateral movement, and I do like that. Okay, very good. How are we doing with time? Okay, very good. Okay. All right. So that was testing the range of motion of the neck Any pain there? Nothing? Okay, so now we're going to do shoulders. This is flexion, the shoulders. Okay, this is extension and hyperextension like this. Okay, abduction, very good. Adduction, okay. Bring your hands to your head. That's external rotation. Okay, bring your hands to your back. Internal rotation of the shoulders. Okay, and now we're going to test against resistance. You could relax. Now push towards me. Push towards me. Your arms. There we go. Now push back. Very good. And now push outwards. Now push inwards. Very good. Okay. And now we would test the elbow joints. Bring it like that. Okay. Flex. Extend. And we don't hyperextend that. And now supination. Pronation. Bring it back like that. Go against my force. Try to flex. Good. And now bring it back. Very good. Very good. Okay. Alright. Now we're moving on to the wrist. Bring your arms up. Okay. Let's see. Flexion. Extension. Hyperextension. Okay. Now you're going to do ulnar and radial deviation. Keep your hands like that. Now push. Just straight. Just push it. Push down. Push upwards. Okay. And we don't do resistance with the ulnar and radial deviation. Very good. How do you feel? Good?
Good.
Okay.
Can I put my shirt on?
Oh, I'm sorry. Here you go.
Thank you.
I apologize. Thanks for reminding me. We scanned the room, right?
Mm.
Okay. Okay. We did the wrist. Now we're gonna do fingers. Flexion, extension, hyperextension. Let's see. Let's do abduction. Spread them. Abduction, adduction. Now try to go outwards. Let me put my fingers through there. Go inwards. Testing motion. Now press towards me. Downwards. And now upwards. Very good. So that was testing all the range of motion of the hands. I'll also do this. I forget what's called. But, all right. Very good. Very good. We also test your thorax and your core. If you don't mind, just try to touch your ankles. Test it for scoliosis. Straight. Very good. You can stand up. So that's flexion. This is extension. And if you go back like this, that's hyperextension. Very good. You're getting all this, right?
Mm-hmm.
Okay. Now let's see. Lateral movement. Lateral movement. No, actually, that's rotation and lateral movement. Lateral movement. Very good. All right. Now, that was the musculoskeletal. Throughout that, we saw full range of motion. And let's see, if we palpate the joints, any pain? No pain in joints. Okay, no pain. So we don't feel any heat, no redness, no swelling. She did good. Okay. Okay, now we're going to the neurovascular exam. First, we're gonna, if you don't mind, just walking straight there. We're gonna look at her gait, just straight.
Wait a
Good,
minute, wait a
good.
minute, I can't find it.
And now just walk toe to toe. Alright, very good. Alright, close your eyes. Look at her. Maybe if you stand here, sweet.
Okay.
All the way in the corner. Close your eyes and bring your hands to your side. Okay. Okay, that's a negative wrong wrist test. And open your eyes and bring your arms up and bring it to your nose. The other one too. Now do it with your eyes closed. Very good. We're testing for cerebellar function. Okay. Let's see. Now we're gonna do a few tests. So if you don't mind just sitting down, I'll actually do this. That's testing for. Okay, quick, as quick as you can. Okay, that's it. That's it. Before we start, just cross your legs. So that's testing for glutes and hamstring and quadricep muscle. If you don't mind doing it for the other leg too. Okay, very good, very good. All right, so we continue with the neurovascular exam. See, we're gonna test for stereognosis. Close your eyes and extend your arm. You're gonna tell me which object that is.
Coin.
Okay, very good. And we're also gonna graph stisha. You're gonna tell me which. What am I doing there?
Number 8.
Number 8. Very good. Okay, we're also gonna do a different test. Pinpoint. Okay. Your arm. Okay, very good. So now you're with your eyes closed. You're gonna tell me 2 points or 1 point. Okay.
2 points. 1 point. 2 points.
Okay.
2 points. 2 points. 2 points.
Okay. We would also do that on the other arm in the trunk and the lower extremities. We also want to test your senses. This is dull and this is sharp. You're gonna tell me where I'm gonna do it, okay?
Okay.
And you're gonna tell me if it's dull or sharp.
Okay. Dull. Sharp. Dull. Sharp. Sharp. Dull.
Okay. Very good. That was that. All right. We're also gonna test. Now we're gonna test your. This is the vibration test. Before that, let's do this sensation test. Keep your eyes closed, and this is up, this is normal, and this is down. Okay. So you're gonna tell me.
Up. No. Down.
Okay.
Down. Normal.
That's neutral, and the toe.
Down.
Very good. Okay. So now we're also gonna test. This is the vibration test. You're gonna test your tendons. So just keep it like that. So you're gonna tell me when you feel it, and when it stops. Okay.
Feel it. Stops.
Okay. We're also gonna do it here.
Feel it. Stops.
Very good. Okay. We are moving along great. So now we're also gonna test your reflexes. Just relax. Relax. This is testing your triceps. Okay, very good. Now we're gonna test your biceps. Okay, very good. This is the radial brachial. Okay, good. And the patellar. Relax. Okay. All of those were noted as +1. And if you don't mind just getting on your, standing up and getting on your knees, we're going to do your ankle reflex. Very good. Just relax. Very good. Okay, that's +1. Very good. Okay. And that ends my head to toe assessment. Thank you and have a good night.